Now, on health matters, the government remains on high alert in readiness to curb down the spreading of the red eye disease in the country. According to the government, Isaac Mwaura, 1 case and 3 more cases have been reported in Kisii and Nairobi respectively. At the same time, Mwaura has announced that the government has already completed Season 3 of polio administering in most counties. Now, our very own Nelias Wanjiru with more.
As the red eye disease is on the rise and now a big threat in the country after several cases have been reported in Mombasa, Malindi, Kilifi, Kisii and Nairobi counties, the government has already put measures to curb the disease.
The government takes note of the outbreak of the red eye disease in the coastal region, specifically in the counties of Mombasa, Lamu and Malindi. Few cases have also been reported in other parts of the country, 1 in Kisii and 3 in Nairobi County. The disease is spread by touching eyes of infected persons or contaminated surfaces, then one touching their eyes.
According to the government spokesperson Isaac Mwaura, the disease is not fatal and Kenyans should not be much worried about it because it is curable. He has urged Kenyans to maintain hand hygiene since it spread through touching eyes after interacting with an infected person.
Members of the public are therefore advised to frequently wash their hands and keep off touching their faces, disinfect high-touch surfaces, and don't share personal items like towels for those affected. I don't know how that would work in a homestead. They are self-advised to self-isolate to reduce spread.
Mwaura has also announced that the third season of polio immunization in various counties, which kicked off last week, has been concluded. The exercise after it had been postponed due to El Nino rains.
In an effort to further fight this outbreak, the government has conducted 3 rounds of supplementary immunization activity, in brackets SIA, that's what they are known as, with 7,683,235 children already covered in the counties of Garissa, Kiambu, Nairobi, Kajiado, Mandera, Wajir, Garissa, Tana River, Kitui, Lamu, and Machakos counties. We have also enhanced surveillance at the national and county levels, and currently the government is doing collection of environmental samples twice a month in Garissa County.
At the same time, the government have already given out 1.2 mosquito nets countrywide to combat the spread of the Rift Valley fever.
The public is further advised to avoid handling and consumption of uninspected meat, to use protective equipment when handling animal births, discard animal stillbirths, and carcasses should be disposed of immediately. Individuals experiencing a fever are advised to visit the nearest health facility for assessment. The government has also distributed over 1.2 million insecticide-treated mosquito nets across the country, and members of the public are advised to use them.
The government spokesperson Isaac Mwaura has said the Kenya Kwanza government is focusing on agriculture, business and the health sector to make sure that they render their promises they give out to the Kenyans dubbed hustlers. Reporting for Hope TV News Watch, my name is Nelias Wanjiru.